G'day and welcome back to the channel. So today's video is for anyone who is dealing with persistent lower back pain. But more specifically, I want to try and help you uncover what your back's directional preference might be. Now, as a physiotherapist, when we're dealing with specific types of lower back dysfunction, we know that certain types of lower back dysfunction either respond or get irritated with a particular direction of movement. The ones that we look at the most commonly are a flexion or extension based movement pattern. So if you are someone who is dealing with a stenosis, where the gap that the nerves come from in your back has reduced, or you're dealing with some arthritis or a nerve root irritation of some sort, flexion-based position where the spine is opening up might start to take some of the tension out of those aggravated and irritated areas and start to relieve your symptoms relatively quickly. Having said that, if you have a joint sensitivity where it is stenotic or you do have a nerve root that's irritated, extending your back may compress those tissues or at the very least increase the risk of irritating those tissues and aggravate your symptoms long term. So it does pay to try and figure out what particular type of movement your back may or may not be responding to for clues as to what direction you might need to practice to try and get that tissue to settle down. So what I want to go through in this video is I want to go through a very scalable set of flexion-based directional preference type movements and then follow that up with some extension-based directional preference type movements that you can do specifically for yourself to see in real time which ones may be helping or aggravating your symptoms. So some of the symptoms you can keep an eye out for that might indicate one directional preference over another. When lying down, if you find that lying on your back is more comfortable or lying on your side is more comfortable, then you might find that they are relatively flexed based positions and you may have a flexion based directional preference. Conversely to that, if you find lying on your stomach feels better, that's relatively an extended position for your back and that may indicate an extension based directional preference. When sitting down, if the act of sitting feels comfortable to you, then that is again a relatively flexed position that may indicate a flexion preference. If you then stand up from sitting and it feels uncomfortable, where your spine goes from a relatively flexed position into a more extended position, if that movement irritates you, then you might find again, you may not enjoy extension, it may be a flexion preference. If you are someone who feels more comfortable standing related to sitting, again, standing is relatively more of an extended position than sitting. So if it feels more comfortable to stand, then extension-based movements may feel better for you in the long run. And the next two are pretty obvious, but if you are standing and bending forward feels better, flexion preference. If arching backwards feels better, extension preference. And it goes without saying that if you notice that any one of those positions makes you feel same, better, or worse, then we can start to angle you back towards those exact situations to try and improve your symptoms. So if we're thinking that your back has a directional preference towards flexion, the first position that we can adopt is very simply just a lying down on your back position. Now, this alone can make you feel really nice, but it's not an active enough of an exercise to try and promote progress with your rehab. What we can add on top of this is we can add basically what's called a posterior pelvic tilt. Essentially what we're doing, if you can imagine that your pelvis is a bowl, we're basically trying to tilt the pelvis back towards you and essentially pull the front of the pelvis towards you, but the back of your pelvis away from you. And this pulling the back of your pelvis away from you is essentially a gentle way of opening up your spine at the back. If you have any radicular or referred type pain into your legs, pins and needles, numbness, achiness, whatever it might be, something as simple as a posterior pelvic tilt could be something that starts to change those symptoms in a short amount of time. So with each of these exercises, we can start with something as simple as, 3 sets of 10. But ultimately, if you're doing this and you're feeling a tangible change in your symptoms, keep doing this until you either get sick of it or you stop making change. If you want to start to progress this a little bit further, we can get you to do the knee to chest. Ideally, we get you to start with one on the side that you feel symptomatic. If you can tolerate it, ideally, we want you to progress to both knees. This is really important to progress to because when you pull both your knees together, it more aggressively rounds your lower back and opens up the tissue at the back as your pelvis is lifting up off the bed. And we want you, again, keep doing this, do enough of these to feel like the symptoms start to open up and start to free up a little bit, but ultimately paying attention to how you feel and stopping when you feel you've stopped making change or if you feel like you've had enough. So once you've done some knees to chest, again, you can hold this position for a minute or two if you want to. But another exercise that we can do beyond the knee to chest is the exercise that a lot of people have done before, where you pull your knee up and then gently pull your knee to the opposite side to where you feel your symptoms. So if you feel you have a left-sided issue, not only does bending forwards open up your spine, or a flexion-based position opens up your spine, but rotating your lower half to the opposite side also opens up that tissue as well. So you might find that you can get a little bit of opening in your lower back. There might be a nice stretch there. It may also open up the side of your hip here, which might also be contributing to some of your leg or hip or even back symptoms as well. We can get you to gently, actively rotate over there using movements to try and take that tissue and open it up. Again, doing enough of these to see some change. So we're getting that sort of flexion-based bias, but then also the opening up version of the rotational bias to hopefully see some results in your symptoms in the short term. So once you can feel you can tolerate the exercises lying down, it's important to progress this to a sitting and a standing based position. So a great exercise for someone who has a flexion directional preference is to do the same thing in sitting. But essentially the exercise can be just bending forward as far as you feel comfortable and then coming back up again. But that can sometimes be a little bit taxing for your back, not so much on the way down. If you have a directional preference, it may enjoy this really well. But when you come back up again, you need to use a lot of the muscles and the joints in your back to bring yourself back up again. And if you are someone who has a bit of a sensitivity towards extension, where you don't like extension, being in extension might obviously feel uncomfortable, but so might coming back into extension from a flex position. So what I ultimately ask my patients to do is, with your hands on your legs, if you can slide your hands down the front and the sides of your legs as low as you feel comfortable, and then before coming back up again, place your hands on your knees and use your hands and arms to assist you to come back up to the top. By putting the tension through your arms, through your knees, it does take a lot of the load off your back and just increases the likelihood that it won't irritate your back on the way back up again. But again, just bending forwards as far as you feel comfortable, making sure that you go as low as you can possibly get, and then just walk your way back up and just respectfully come back up to the top. Do 10 or 15 of these, do a couple of sets of those. Make sure that you feel like those symptoms are disappearing the more you tend to do this. But again, ultimately, much like the knee coming up and over to the opposite side, we can bias the opposite side here as well to open up that tissue. So again, if you do have left-sided symptoms or left-sided leg pain, for example, instead of coming straight down through the middle of your feet, try coming down and over the opposite foot just to open up your back a little bit more. And then again, make sure you come up and assist yourself back up again on the way up. Bring yourself all the way back down again. Slide down towards the ground as low as you feel comfortable going. You can bypass the knee if it feels comfortable enough for you, but then assist yourself back up again. But twisting away to the other side at the same time, that flexion and opposite side rotation and opposite side bending may ultimately make these exercises even more effective for you in the long run. And then to add a little bit more variety into this, especially if you feel like the sitting and lying down exercises may be helpful, but maybe not ultimately helpful enough, we can try and do the same thing in standing. You can just bend as far down as you feel comfortable, but again, just help yourself back up again. If you have your feet wider apart, and instead of coming straight down, if we get you to come off to the side and go down towards the opposite side, you might find, again, similar to sitting, it gives you a chance to expedite the benefits of those symptoms and the exercises that we're doing. So now when trying to bias an extension-based directional preference, it's simply going in the opposite direction. So again, if flexion-based biases tends to be lying on your back, then lying on your tummy is a relatively extended position for your spine. So again, much like lying on your back, if this position feels like it helps your symptoms, just being here when you're resting can just help consistently put some positive input into your system in a way that it may be appreciating and responsive to. But we want to give you some exercises that actively improve this position for you. So a simple thing that we can begin to do is essentially a modified sort of cobra position where we're relatively extending through your back, get you to be onto your elbows. Again, you can just hang out in this position if you feel like it is relieving for you. But ultimately what we want to try and get you to do is trying to get you to do an extension-based movement where you're trying to close down some of those joints and get that tissue to move a little bit further. An extension-based preference puts more tension through the posterior or the back section of the disc. One of the theories that we work with is if you do have a disc bulge, they're trying to put some pressure through the back of the disc, can somehow encourage that disc to recenter and centralize again. But what I'd like you to do when you do this is just to make sure we're doing the best mechanical job we can Squeeze your bottom first to put your pelvis in a good position. Try and draw your belly up and in towards your spine, again, to put your back in a good position. And then extend backwards. You should find it's a slightly different experience than if your butt wasn't squeezed and your tummy wasn't engaged. But ultimately, we can get you just to come up to the level that you feel comfortable with. If you have quite nasty back pain to begin with, you might find that a very small range of motion is all you can manage to start with. But eventually, we want to get you progressing as far back as you feel comfortable going. What you can also do, similar to the leg coming up and over with a flexion-based preference, if you come up into this position and you feel like it is helpful, but then if you rotate towards the same side, you might find that when we rotate towards that side side closes down a little bit more. That may assist your ability to get progress with an extension-based directional preference. So extension and the same side rotation can be really helpful to try and bias the tissue that you need and give your body the input that it might be looking for if it has that extension-based directional preference. So once again, some variety that you can try besides lying on your tummy and arching backwards is we can do the same thing in standing. Now remember, if you have an extension directional preference, standing and walking around may naturally feel more comfortable for you than sitting down and relaxing. So if you find that sitting isn't necessarily the best position for you, maybe lying down on your tummy might be better, or if you need to stand up a little bit more and lean on something, that might also be more favorable for you. But if you are in standing, one of the directional preferences that we can do to bias extension is literally placing your hands on your lower back. You can have your hands in the middle of your back where you're trying to extend through, just to add a little bit of a hinge point there to make it a little bit easier for you. One of the little tips that I like to give people is, again, make sure that you squeeze your glutes to put your pelvis in a good position. This will allow you to make a little bit more of a concerted effort to direct the motion through your lower back, through the sections that feel the most important for you. We want to just gently work in and out of the range, whatever you feel comfortable doing. We can also go back and to the side a little bit more if you feel like your body responds to that extra little bias as well. But as with all these exercises, we want to do enough of them for as long as it takes for you to feel like those symptoms are consistently getting better, or until you feel like you've stopped making change. But ultimately, as I said before, once you feel like your symptoms have resolved to a level that you feel happy with, we still need to build the capacity around the other movement directions that maybe your back doesn't feel comfortable with. So if you have a flexion directional preference where bending forward has made your symptoms feel better, at some stage we need you to tolerate extending backwards, otherwise we haven't restored the normal function to your spine. But what I can say is that once your initial aggravation and irritation and symptoms have settled, it will be much easier to get that back because your brain isn't feeling threatened, it's not feeling on edge, it's going to be more accommodating to gently working through some mobility exercises to improve the extension-based movements that you may have, or another type of movement that might ultimately be irritating your back previously.